Hadien ke jingwan link shop jong ka klam COVID-19 bat watla ke Sorkar lemba ke tanat ka kot ka khia kaya lam ya kipat ba ban shim ya ketika iada COVID Henry kumba ka pau menta daki hajar ngut kinong trei ka kot ka khia kim shania ne tre satya ban ya ketika bat ki babo na kini ki de ki nong trei haki hospital Sorkar u menteri bakhmi ya ka kot ka khia hapo ke jylla u James PK sangma haba jubab hapo ka yeng dorbar ula pintip bakat kum ke jingwan benia da ka Indian Institute of Public Health Shillong kalalap bakidon Haduh hajar sanspa sangut ki nong trei ka kot ka khia ki bam tre satya ban ya ketika yada COVID-19 na kini hajar sauspa sanpuhan ringut ki de ki batrei haki hospital Sorkar kadba sapu khandaigot ki de ki batrei haki hospital Shimen haba wanra ya ka kaipot bapura haka kenta keli bajubab UMLA ka AITC hakaliang persya uba Himalaya Muktan Shangpliang uloong ba katkum ke jinglap ka IIPH kidon Haduh kendai pulangut ki doktor haki hospital Sorkar ki baklam tika sauspa dri pu arngut ki nurse but sauspa lai pu nyongut pat ki we ki nongtre haki hospital Sorkar ki baklam tika yada COVID-19 kadba haki hospital Shimet ki don sau pulangut ki doktor shispa sapu sangut ki nurse but shispa sapu nyongut ki weipat ki nongtre ki bamshim la tika satya katkum gajia thu James sangma ki don bon teli ki daw ba penlong ya ki nongtre ka kot ka khia ban kentat ya ketika panakaliang ka Sorkar ka persang banyai selok batki na kapor syakapor pan pinsngo thu ya ka jingdon kam ban tika ulai thu ba ki daw ki kenthop ya ka jingting yo syakta hadin habut ki jing klumar namar ka jing pin priang Khubor na ki social media don ki basngo ba comment jong ki ka khlan bat biang ka immunity tang nalade don ru ki bating ya uternya pat kumta terter haba jubab shu ya ka jingli u James ulai thu ba ka jinga selok kala yarap hakabala penlong ba Haduh nyopau Haduh prapo persen na kitu ki bam tre ban tika menta kila minjur ban shim ya ka jingeda.
Mr. Speaker, sir, reply to star question 3. A. Sir, the total number is 2,505, which is about 10% hesitancy rate. B. Sir, based on the study conducted by the Indian Institute of Public Health, IIPH, Shillong, there are various reasons for COVID vaccine hesitancy among the healthcare workers. C. So the total number of unvaccinated healthcare workers in government hospitals is 2,456. D. So the total number of unvaccinated healthcare workers in private hospitals is 49. E. So the government is making all-out efforts to conduct counseling and create awareness programs in this regard.
Yes, by Himalaya.
Mr. Speaker, sir, may I know from the Honourable Minister, what is the total number of health workers that are targeted for vaccination?
So the total number is 28,708 healthcare workers, sir, which are serving in government hospitals and 2,000 in government hospitals, sir.
Does that include the ASHAs also, sir?
Yes, sir.
Honourable Speaker, sir, I am privy to a report in my hand which has been conducted by the Indian Institute of Public Health, Shillong. So this survey has been conducted in 4 hospitals, sir. So out of these 4 hospitals, there are private hospitals and the government hospitals. The report says that there are 93 doctors who refuse vaccination in the government hospital. Then there are about 462 nurses who refuse vaccination. There is about 434 non-medicals in the government hospitals. And when we look at the private hospitals, sir, we have only 43 doctors who are hesitant and nurses only 144. non-medical 147. So this picture shows that the hesitancy rate for vaccination is more on the government hospitals and the government health workers rather than the private. And the minister's reply itself shows very clearly, sir, in C and D, that the unvaccinated in the government hospitals is 2456, whereas in private hospitals is only 49. So may I know the reason, sir, why there is so much of hesitancy among the government health workers, sir?
Mr. Speaker, sir, so there are various reasons, as I had mentioned in the course of my reply. And as per the report of the Indian Institute of Public Health, the IIPH, sir, this was a report via a study which was conducted among healthcare workers and the community. So I will just read out, sir, the reasons why people are hesitant to take the COVID-19 vaccine, sir. So one, some people are worried about the side effects after vaccination, and this is in descending order of priority, sir. Number two, sir, messages on social media that cause concern. Number three, sir, some of them have not yet decided which vaccine to take because there are many choices of different companies which are on offer. So number four, some of them feel that natural immunity is sufficient. Number five, sir, some of them are confused by different messages from different sources. Number six, sir, some feel they have developed immunity against the virus. Number seven, sir, some fear needles and the pain caused by needles. Number eight, some fear that the COVID-19 vaccine may affect future pregnancies. Number nine, so none of their friends or relatives have taken the vaccine, so they feel that they shouldn't also. Number 10, COVID-19 vaccines are not safe. This is, some people feel that it is not safe. Number 11, sir, family members sometimes advise them not to take the vaccine, so they go by that advice, sir. Number 12, COVID-19 vaccine causes infertility and impotence. That is felt by some of the people, and that's why they're hesitant to take the vaccine. Number 13, sir, they feel that COVID-19 infection is not serious, so vaccine is not important. And number 14, lastly, sir, influential leaders do not support the vaccine, thereby they feel the need for taking the vaccine does not arise, sir. So these are the reasons which were spelled out in this report conducted by the Indian Institute of Public Health, and I hope that answers the question.
Mr. Speaker, sir, we understand how important vaccination is against this dreaded disease, COVID-19, sir. And we also understand how much the government is spending a lot of money in creating awareness, publicity. I could see a lot of pamphlets, posters, hangouts, hoardings, asking the people of the state to go for vaccination, sir. Now, when the government on one side is asking the people to go for vaccination, they're forcing the people, they're going door to door and asking the people to come for vaccination. Now, on the other side, sir, it's so glaringly shown that the health workers, even the doctors and the nurses, are still hesitant, sir. Now, sir, what kind of picture are we showing to the people? That when the doctor himself is hesitant, then the public would say, when the doctor is not taking the vaccine, why should I take the vaccine? Now, I'm not here to propagate against the vaccine, sir, but I'm trying to draw a picture giving a contrast of this whole scenario, sir. Therefore, sir, I understand the situations and the reasons that the Honorable Minister has specified just now. Yes, there are genuine reasons like that. But, sir, I see in the last answer, in C or E, that the government says that they have made all efforts to conduct counseling, create awareness program for such hesitant health workers. Now, may I know from the Honorable Minister, sir, how many such health workers have changed their mind and taken the vaccines?
So it's an ongoing process, and how many have changed, to put it into context, sir, will require a certain timeline, which I think the honourable member, if he so wishes, I can provide that.
Sir, may I just, okay, I wouldn't like the total figure as how many, I'll just rephrase it, sir. Now, what is the kind of percentage that the Honourable Minister could give us, that what is the rate of change of mind that is going on? Whether their mind is still stuck not to take the vaccine, or has it changed after the counseling and the awareness program done?
Yes, sir. Definitely, sir. Counseling has helped to a large extent, sir. And we have seen behavioral changes in people due to these counseling sessions, sir. And this is an ongoing process, sir. As we speak, a lot of people are coming forward to take vaccines. This is something that we are not, discontinuing with that process of counseling, so that people, whoever so wishes, can keep coming, sir. And I would say, sir, 70 to 80% of people who were earlier hesitant to take the vaccine have come forward and have forward to take the vaccine. So, but that is over a period of time, sir. So that would be more specific, sir.
Thank you, sir.
Mr. Speaker, sir. So this is a very important time. I must say that from all the 60 MLAs, even the state as a whole, we have to support the health workers in the state. So in spite of that, we cannot deny the fact that in every constituency, even the state, many have come forward and given the vaccination. So may I know from Honorable Minister the total number of vaccinated in the state? In the first dose, how much? In the second dose, how much?
Sir, as of now, sir, I can give in terms of percentage, sir.
Okay. Yes, yes.
So the first dose coverage for the first dose, sir, is 70.24, sir, percent, and the total coverage for the second dose, sir, is at 57%, sir, right now.
So only one more question, sir. So we heard about the reply given Honorable Health Minister. We could see that there's a positive step taken by the Health Department. So may I know from the Honorable Health Minister, is there any health workers in the state you have given about the booster dose, sir?
I'll require notice for that, sir.
Yes, Silent.
Mr. Speaker, sir, during the course of reply, our Honourable Ministers stated that some of the doctors and health workers are still under counselling. That means they are not in the normal state of mind. So those who are not in the normal state of mind, whether they'll be still working as a head worker, because they are looking after the patients, even the doctors. So what will be the status of those abnormal people looking at those who are getting a counseling right now? Because any person who are under the counseling should not have the normal job. They are given some kind of holidays. So those who has not been or still under counseling, whether they'll be given any kind of holidays, so as to after coming back they will get the counseling. After getting the counseling only, they should be given back the normal job. So I would like to ask the questions, what stage they're right now? Whether they'll be given any kind of holidays or after the counseling, they'll be given back the normal job.
Sir, counseling, sir, does not necessarily mean, sir, that it is because of specifically certain, distress or mental issues. Or counseling is a very, very large area, sir. And in this regard, sir, the counseling is specifically to dispel certain kind of myths that people may be having about vaccination and the ill effects of vaccination. Counseling could be to, convince them that this is, for their benefit. So, doesn't mean that the doctors are facing any mental issues, as the honorable member was suggesting. It just means that counseling is to reassure them and to convince them that the vaccine is something which is required and they should take it for their own benefits, sir. So I don't think that there is any requirement for these doctors to take leave. They are carrying on with their functions. Some of the doctors may not have taken the vaccine, sir, because maybe they were infected with COVID, and then it requires a certain period of time before which you can take the vaccine. So there are many, many reasons why some healthcare workers did not take vaccine. I don't want to go into all those details, sir. But having said that, sir, counseling is meant to reassure people and to convince them that they should go ahead and take the vaccine.
Mr. Speaker, sir, why I am specifically asking about counseling, especially for these doctors, because they are directly linked with the physiology of the body, of mind and state. Now, if they are not normal, how do they supposed to enter to look after the patients who are having a disease within oneself? For example, I myself have forced my mother to, get the COVID injection. Whereas, how do these doctors supposed to, convince those patients to get the injection or any kind of medicines to the patients who are coming to examine for any kind of physiology disorder that they're having? Because they themselves are having that physiology disorder within themselves. How do they supposed to convince the patients to take the medicine and the patients to take the injection? This is the state, they are having in that state of mind that they themselves need to be counseled. The health workers, how do they supposed to convince the patients who are having some kind of a psychology disorder? They are health workers and they are doctors. So they needed to be addressed, and then, their approach should be different for them actually. If this is other doctors, like doctors of philosophy, then that could be understood. But there are doctors of, there are physicians actually. So these things directly relates with the physical body and state of mind of people.
What is the question?
So my question is whether if they are still undergoing counseling, whether any kind of holidays or any kind of, counseling be given to them first, then only let them come to the job. Otherwise, it seems like they are not in a normal state of mind.
Okay, Minister.
So, counseling was conducted during the month of April and May, June last year, sir, for the doctors. And so now less than 1% of doctors are left who have not yet taken the vaccine, sir. So this is, and as I said, sir, some of the reasons may be because of, maybe they were infected with that, COVID and they couldn't take it immediately. But then, sir, this process is going on, sir, and I'm very confident that we will be able to achieve 100%. But now less than 1% of doctors are unvaccinated, sir.
Honourable Speaker, sir, I would like to ask the Honourable Health Minister, has the state of Meghalaya achieved or attained herd immunity by now after the third wave?
So, herd immunity is a subject which needs to be, I think, study has to be done on that, sir. So I do not have that information with me right now, but that is something that I can inform the honourable member later on, sir.
Honourable Speaker, sir, question that I'm asking about herd immunity is that once a nation or a state has attained herd immunity, there's a high probability that this vaccination procedure and the approach of this procedure changes. So may I get some clarity from the Honourable Minister, please?
Sir, this is a state, sir, this is a situation where, sir, a lot of research is still being carried out, sir. There is still a lot of things still in the domain of, in the realm of speculation, sir. But, sir, I think that in terms of herd immunity, sir, really, I don't want to go into that area to risk saying that yes, we have a herd immunity or we don't have herd immunity. That study has to be conducted, and I agree with the honourable member that eventually some countries have realized that because of herd immunity they are going back to a state of normalcy. But as of now, sir, I cannot mention anything about whether we have or we don't have, sir.
Mr. Speaker, sir.
Please put a question.
Yeah, sure. Whether all the MLAs have been vaccinated and even the MDCs also, all the representatives?
To the best of my knowledge, yes, sir.